They're talking about themselves.
That's true.
Am I wrong? Am I wrong?
Yeah, right, you're right.
Okay.
It's true. Okay, so what makes ACT unconventional? Unlike all the other psychologists, they try to convey the idea that we are here to help you, to rescue from the pain.
Oh.
But ACT therapists don't say that. They say pain is normal. And it is important, and everyone has it. You're not the only one.
Uh-huh.
So the ACT therapist, Steve Hayes spent like about 30-40 minutes just of the workshop time just explaining that like everybody has psychological pain, and having the pain is normal aspect of human psychological life. And you cannot deliberately get rid of your psychological pain. In fact, if you try to remove it more harder, then it's gonna come back harder too. So you can take steps to avoid increasing it artificially. So you can do something about it, but don't try to remove it altogether, because it's not gonna work. And psychological pain is part of our lives. So accepting your pain is a step toward kind of reducing the suffering. So it's a kind of very unconventional approach to psychological pain.
That last point, though, is kind of in line with the idea of learning to tolerate. And tolerate, accept, regulate, and where you can tolerate, intense symptoms, like for example of anxiety, just realize, okay, this is not going to kill me. At some point, you realize, well, you accept it. I don't know. I'm just reflecting where there might be a line of connection.
Yeah. Like the unified protocol we discussed last week.
Yeah.
There's some bridge between ACT and CBT. Yeah. So kind of accepting the pain and sitting with it, and then kind of having a perspective, looking at your pain, kind of step outside, not really being wrapped up in your pain. So it's something like that. And there's a pain management field of psychology, and what they try to tell is that do not try to remove pain or control pain. Just have a ride with your pain.
Kabat-Zinn.
Yeah, kind of like just accept the pain and try give up on the control of the pain, and accept the pain, and then think of it as pain is sensation. Pain is not you. Pain is not your life. Pain is just sensation, like all the other sensations. So in ACT, they try to give perspective of psychological pain, rather than going inside the pain and then try to argue with it and then change the content of the pain. So ACT asks you to change your perspective, kind of try to change the way you deal with your personal experiences. And it focuses on the substance, not on the appearance of the problems. And it kind of try to learn to approach your distress in a different way. So if you think of cognitive therapy, we sometimes argue with your client say, I'm always a failure, and then you kind of try to give counter evidence that that's not the case, it's your cognitive error. In ACT, they don't do that. They just say, okay, you have your thoughts. Okay, you acknowledge that you have their thoughts. So it's different. You don't try to dissect the content of the thoughts. You kind of acknowledge that the thoughts exist, and then try to see how the patient is dealing with the existence of the thoughts. Are you going to be overwhelmed by the thought? Are you going to be able to differentiate that thoughts are there and you are not the thoughts? So it may not sound very terribly different, but it's a fundamentally different approach to psychological content of the person. So first, human suffering. It's important for all of us to realize that it's normal. People suffer, it's normal. Pain is not avoidable. But pain can hold you back from living the kind of life you want to live if you are kind of caught up with the pain too much, if you don't know how to deal with the pain. But there's a way to change your relationship with pain. So that's where ACT is focused on. How do you change the relationship between you and your psychological pain? How are you going to define the relationship you're going to have with your thoughts? Your thoughts will be there. It's kind of, kind of breathing itself crazy in your brain. That's human life. Then what's gonna be the relationship between your thoughts and yourself? And for a lot of people, they just don't differentiate. Yeah. My ideas and myself. What's the difference? I think, so I exist. Like most of us, like when we feel psychological pain, that's me. Right. Yeah. So that's why people suffer, because they fuse with their psychological pain. And in ACT try to teach you how to step just one step out of it, which is really hard. Just one step out of it and view it differently. So experiential avoidance is a very useful term in ACT. So people, it's so terrible to have terrible thoughts, negative self-talk. Think about it, you always have negative things to talk about yourself. It's so hard to confront or even carry it. And people kind of avoid those kind of thoughts, feelings, memories. And then that's called experiential avoidance. It includes all this like avoidant behavior of like the avoidance we talked about in CBT, like people with social anxiety, they avoid all human contact. Include that, and also include other more subtle psychological avoidance. When you have like painful thoughts or painful feelings, you tend to try to avoid that. And then ACT kind of considers that this kind of avoidant behavior or psychological avoidance amplify the pain.
I love the word artificially.
Yeah, artificially.
Unnecessarily, artificially.
So, but actually there are studies and experiments that in the ACT book showing that a lot of things outside the body, if you have a splinter, you just remove it and you'll be free from pain. It's not really outside the body, it is kind of inside your body. But anyway, so if you have some sticky, yucky thing on your hand, you wash your hands, remove it, and you're fine. But inside your body, especially inside your mind, the rules are if you aren't willing to have it, you will. You try to avoid it, it'll hunt you down. It will follow you around. And if you try to reduce it, it will become even more stronger. It happens to OCD patients. They have all these like obsessive thoughts. They really don't want to think about it, and they become even more stronger. So that's experiential avoidance. So ACT principles, they use these three skills. One is mindfulness, and second is acceptance, and third is commitment and value-based living. So acceptance and commitment therapy comes from this. So I will explain one by one. In acceptance, we try to fix our internal experience just like we would do it in the outside problem. But the painful things, internal painful things, we try to fix it. We try to sort it out so that we can eventually remove it. But all the internal events are not like external events. They don't go away. It's really hard to let it go and nearly impossible. And in ACT workshop, they often do this experiment of pink elephant.
Yeah.
Have you done it somewhere?
Yeah.
So the experiment is that for the next 5 minutes, don't think about pink elephant.
I was already thinking about it before you said it.
And then you do the experiment when you have time. It's impossible. Yeah, like OCD patients. No, you can't think about it. You think about it even more. It's impossible. Yeah, it's not like you get some dirt on your hand and you just wash. It's not like that. It's gonna just follow you around. So in ACT, they say it's not a matter of removing it. It's a matter of how you go kind of accept it and then deal with it and still move forward with your life. So in acceptance concept in ACT, if you try to remove it, it's going to entangle you even further, and it's going to become more even traumatic things. In ACT, you accept. I will always have this noisy mind who tells me horrible things, and I will always have this like psychological pain or some crazy ideas and all that, but I will still move forward with my life. So it's kind of different attitude. If you are stuck with psychological pain and you just use all of your energy to try to remove it, your life will be wasted with this battle. But if you think, oh, I have my life, and this psychological pain is going to be always there, so I will kind of learn how to deal with it and just move forward with my life. So that's kind of different way of viewing it. And in this, there's interesting video, but I don't know, you may not have time to watch it.
Oh, that's nice.
Yeah. You know what it is?
Is it the one with the
Unwanted party guest.
Yeah, this horrible, stinky neighbor who comes in and
oh, did he show it somewhere?
invades the? No, it's Andrew Polloy in the counseling center showed it to me.
Oh, yeah. So
It's quite funny.
I don't know.
How long is the
We
funny.
cut them. Yeah.